Nothing went wrong during those 9 months of the mother's pregnancy. Nothing she ate, medication she took, activity, or emotional experience she encountered could have caused this disorder. Today, I'm going to talk to you about what Down syndrome is and the history behind it, the signs, symptoms, and complications that may arise, the risk factors that may result in a child getting Down syndrome, and the treatments for the child and the family. First, I'm going to talk to you about what Down syndrome is and the history behind this genetic disorder. According to WebMD, an online website, Down syndrome is also known as trisomy 21. This is a genetic disorder that occurs in approximately 1 of 800 live births. This disorder is evident at birth, causing varying degrees of mental handicaps and physical abnormalities. According to Google Health, Down syndrome occurs when there is an extra copy of the 21st chromosome, as you can see here. This extra chromosome causes problems with the way the body and brain develop, and this disorder is the most common single cause of birth defects in children. Now, for the history about Down syndrome. Down syndrome was discovered 147 years ago by a British physician named John Langdon Down in the year 1866. But in 1866, it was known as Mongolism because of the facial features resembling those of Asians. Later on in his career, John became known as the father of the disorder. Second, I will talk to you about the signs, symptoms, and complications and the risk factors that cause Down syndrome. Some physical are the head is abnormally shaped, they have a flattened nose, a single crease on the palm of the hand. When we have 2 right here, they have 1. Small ears and mouth, wide, short hands with short fingers, and tooth problems. Some mental, they have delayed language development, slow motor development, slow learning, and they have short attention spans. Some health conditions are birth defects involving the heart, dementia, intestinal problems, and sleep apnea. Some complications are eye problems, hearing problems, ear infections, heart problems, weak backbone at the top of the neck, spinal cord injuries, and their airway might be blocked when they sleep. Some risk factors state that the older the mother is, the risk increases for them to have a child with Down syndrome. According to the 2000 World Book Encyclopedia, a 25-year-old woman has a 1 in 1,250 chance she'll have a child with Down syndrome. A 30-year-old woman, 1 in 1,000. A 35-year-old woman, 1 in 400. A 40-year-old woman, 1 in 100. And a 45-year-old woman is 1 in 30. And the risk also increases if you're a mother that has Down syndrome already. It increases by 50% that your child will have Down syndrome too. Thirdly, I will talk to you about the treatments that can help the child and also the family. There are the physical education and the family as well. Physical education training is offered in most to all communities, and they include either going to school or seeing a speech therapist or an occupational therapist or their doctor. Also, the family plays a big role in treatments. The family can either bring their child to a foster home if they have a severe case of Down syndrome, but if they have a less severe case of Down syndrome, then the child can live at home. And it is stated that if a child lives at home, they have a higher IQ and they achieve more in life. And for the family, there's also a long-term professional help. Remember, Down syndrome is not a disease, but it is a disorder that can affect everyone's lives around the child that has it. It changed my family's lives because of my cousin. He has Down syndrome. And everyone should treat those children that are different like a regular person and look past all the differences they have.